Hello, David. How are you?
I'm good.
That's good to hear. I'm glad that we were still able to meet despite the circumstances and everything that's going on.
Yeah, me too. I've been looking forward to it.
Good. So, why don't we start with why you're here today?
Well, I have high blood pressure, and I'm also trying to lose a little bit of weight.
Okay. So, are you currently following any diet restrictions for your heart health or your blood pressure?
Unfortunately, no.
No, not right now. Okay. Well, why don't we start by finding out a little bit about what you eat on a daily basis, and we can go from there. So, do you think you could give me a summary about what you usually eat in a day?
Yeah, I drive a truck. In the morning, I don't have anything for breakfast, and usually, sometime a little bit after noon, maybe even closer to like mid-afternoon, I usually have some sort of snack, like a bagel with cream cheese or something like that. And then when I get home, we either order takeout food, like a Subway, or my wife cooks me a meal like pasta or some sort of chicken or meat dish.
Okay, so it sounds like you normally have around like 2 meals a day, and it's best for you that they're convenient. And usually your wife will do the cooking if you guys do eat from home.
That's correct.
Okay. And what about any exercise? Is there anything that you do to try to do that?
Other than working on when I loading cargo on the truck, other than that, lately I've taken a couple walks with my wife during the week, but that's about it.
Okay. Is there any barriers that you foresee that are stopping you from starting a healthy diet that you want to talk about?
Well, I'm a truck driver, so
Okay,
that's
yeah.
one thing, and I like good food, good tasting food,
Yeah,
and I don't. I'm
I'm
not
sure.
a good cook, so my wife does all the cooking.
Okay, yeah, and I'm sure driving on a truck all day that can be difficult for you to stop and eat food. You don't have time to take a break
That's correct.
if you're driving. Okay. Are there any times that you've tried to make a change in your diet and you've been effective?
Yeah, I've tried twice. Once I did the Atkins diet, and I lost about 60 pounds. And when I went off of it, the weight came right back on. And more recently, I did the Weight Watchers diet. And in that one, I actually lost 89 pounds.
Wow.
I went on a cruise, and I didn't go back on it, and a lot of the weight came back on.
Okay, and what parts of those diets do you think are what were helpful for you to lose weight?
Well, on the Atkins diet, I think it was reducing the sweets because I definitely like my sweets.
Uh-huh.
And on the Weight Watchers, it was more like a calorie control.
And did you notice that your blood pressure was more controlled when you were on these diets as well, or not really? It was more just the weight loss.
Well, actually, on the Weight Watchers diet, my blood pressure medication got reduced in half
Wow.
when I
Okay.
lost that weight.
When you lost the weight. Awesome. So there is actually two diets that are pretty highly recommended for heart health and also help to lose weight. One is the Mediterranean diet, and the other is the DASH diet. So the Mediterranean diet, it's a primarily plant-based eating plan. It has daily intakes of whole grains, olive oil, fruit, vegetables, beans, spices, things like that. It has less of a focus on proteins. Those are eaten in smaller quantities, and the animal proteins that they do incorporate tends to be more like fish. And then there is the DASH diet, which focuses, kind of on what the recommendations are for daily intakes of food, anyways, which is like fruits, vegetables, low fat and fat free dairy, whole grains, nuts, healthy fats, and lean meats. And then they encourage to reduce sodium intake and sweets. So I know that's a lot to throw at you. They're both really good diets.
Well, I definitely don't like fish or seafood.
Okay, yeah. Based on what you were saying that you normally have, like meats and stuff like that, and you were successful with Atkins, I feel like the DASH diet might be something that would suit your preferences better.
I think
If
so.
you think so, yeah. I actually have a PowerPoint on the DASH diet, and I can share this with you, and we can go over it together so you can kind of get more of an understanding if you think this is something that you'd want to try.
Okay.
Okay, so let's just pull this up. And I'm just gonna go to the beginning. Can you see that?
I can, yes.
Awesome. Okay, so we'll just do a little overview of the DASH diet together. So the DASH diet stands for Dietary Approaches to Stop Hypertension. And it says it's a diet, but really it's like a lifestyle. And I think that that's one of the things that would be more helpful, because some of these diets, they are helpful, but they're hard to maintain for a long period of time. This was designed originally to help prevent and treat hypertension through nutrition, and had some effect, and some studies have really shown that it can lower blood pressure the same as medication, so you wouldn't even need it.
Wow.
But that is something, that would be talked to with your provider, but it's definitely something that can also work together with it. So it also helps to decrease the risk of heart disease, stroke, kidney stones, diabetes, and some kinds of cancers. And it does help promote weight loss, which I know is another goal of yours.
Yes.
The DASH diet, it consists of fruit, vegetables, low-fat and non-fat dairy, fiber, whole grains, lean meat, fish, nuts, and beans, which is, a lot of variety of food that it focuses on, and are all things that are healthy to eat and within good quantity. So we can break it down a little further. Based on a 2,000 calorie per day diet, they would recommend grains. You would have 6 to 8 servings. So an example of a grain would be like bread, cereal, rice, pasta. And an example of a serving of a grain would be like 1 slice of bread, an ounce of dry cereal, or a half a cup of cooked cereal, rice, or pasta. So you want to try to make at least half your grains whole grains, like doing half brown rice and half white rice, or even better, if you do like whole grains, all brown rice. And then grains are low in fat, so we want to try to keep them like that. So I know that you said that you'll have bagels and stuff, and maybe we can start to try to look at other alternatives and avoid adding things like cream cheese and butter that are higher fat items that would kind of counteract the benefits of having the grains.
Okay.
So fruits and vegetables are another part of the DASH diet. They recommend 4 to 5 servings per day. 1 serving of vegetables would be like a cup of leafy greens, or a half a cup of cut up or raw vegetables, cooked or cooked vegetables. And a serving of fruit would be like a medium fruit, a half a cup of fresh or frozen or canned fruit, or 8 ounces of juice. 100% juice, that is, could actually count as a serving of fruit, which is something that might help if you do like fruit juice. And, a tip could be to mix it up. Try to put different colors of fruits and vegetables on your plate to make it more exciting to eat, and also to get more vitamins and minerals, because different fruits and vegetables have different vitamins and minerals. They're not all the same, so.
Okay.
So we could also look at the dairy that's recommended in the DASH diet is 2 to 3 servings per day of dairy. An example of a serving of dairy would be like a cup of milk, a cup of yogurt, or 1.5 ounces of cheese. And remember to choose low fat or fat-free options. So something like 1% milk or fat-free milk, or yogurt would be a better option for you to choose, or reduced fat cheese. We have also, so the last big thing would be like lean meat, poultry, and fish. They recommend 2 servings or less per day. An example of a serving would be like 1 egg, an ounce of cooked meat, poultry, or fish. Especially with poultry, I know you said you have like a meat like a chicken. You want to try to trim away the skin and the fat. Instead of frying it, I would recommend baking it, and those are ways that you can also work to reduce the fat.
Okay.
And if you did eat fish at all, I'm not sure if you have any fish, but choosing a fish that's better for heart health would be fish like salmon, which is high in omega-3, which is beneficial for your heart. Then we have the smaller things like nuts and seeds. Those you want to try to have 4 to 5 servings per week, not per day. Like a third a cup of nuts or a half a cup of cooked beans is an example of a serving. Fats and oils, you want to try to have 2 to 3 servings per day, and try to have things like margarine instead of butter. Another example of a serving would be 2 tablespoons of salad dressing or 1 teaspoon of margarine. And this we really want to try to make less than 30% of our total daily intake of calories from fats and oils. And sweets, we really want to try to limit to 2 to 4 servings per week or less, like a half a cup of sorbet or a tablespoon of sugar. And something that you could try, I I don't know if you drink coffee or something, but you could try artificial sweeteners, which could reduce your caloric intake if you do need sweeteners. And lastly, we have sodium. So sodium, we really want to, based on a 2,000 calorie diet, the DASH diet recommends to keep less than 2,300 milligrams per day. You can find the milligrams of sodium if you look on the back of the nutrition label. It says the milligrams on the back. I don't know, have you seen that before, that it shows the milligrams of sodium?
I've never looked for it, but I'm sure I could look for it.
Yeah, so we can practice looking at that as well. And that would show you how much is in it, and you can try to figure out, how much you're having in a day and keep track of that in a food diary. So another tip, if you do have vegetables that are canned, you can rinse those off, and that would actually remove up to 41% of sodium. Another thing is if you add a lot of salt to your food, you could try adding garlic or something like Mrs. Dash, which is a salt substitute, which could reduce your sodium intake. And try to avoid foods that are just high in sodium. There's nothing you can do. It's like deli meat and canned pasta might be something you want to avoid. One recommendation that my mom gave me that I like is I will get like crushed tomatoes and instead of pasta sauce, and I'll use that instead and just season it myself with something like garlic.
Okay.
So I have this up. So why don't we try together now to think of 2 goals from the DASH diet that you think that we could come up with that you would be able to achieve by next time I see you, which is in 2 weeks. So these could be small goals, just anything that you think is achievable by the next time I see you.
All right. Well, I definitely very rarely eat fruits and vegetables. So maybe I can go with 2 servings of fruit and 2 servings of vegetables. And my other goal, I eat sweets almost every day. Maybe I could reduce that to maybe 2 or 3 times a week.
Okay, so you think for the first goal, maybe we could try to incorporate maybe 2 servings of fruit a day the first week, and then also add in 2 servings of vegetables a day the second week, along with the fruit. Is that what you think would be an achievable goal?
Yes, I think I could do that.
And maybe we could reduce your sweet intake to maybe 2 or 3 times a week the first week, and definitely 2 or less times a week the second week before you see me. Is that something that you think that you'd be able to do?
I think I could do that.
Okay, so we can write those goals down. I can exit out of this. Let's see. Okay, so yeah, so how about a good thing that we can start with is if you want to get a notebook or something, you could maybe keep like a food log of what you've been having for those days, and really at least try to definitely record the times that you eat fruits and vegetables and sweets, especially at first, since that's what we're focusing on. And you can better visualize, okay, so I already had 1 serving of fruit a day, so now I just need my 1 more. Or maybe you already had something sweet that day, so maybe you know that you're gonna avoid that for the next couple days.
Okay.
Yeah, so then next time we come, then you'll have all of your food diary logs for those 2 weeks, and we can look at those together and see maybe where you struggled and where you didn't. So maybe if you want to put a note next to some of those days and be like, I had sweets this day because they were at the office or because your wife brought them home, and we can figure out where those underlying things are that are making it more difficult.
Okay.
And I was thinking, I really like that you said that you were starting to walk with your wife. Maybe we could try to make that a goal as well. I'm sure your wife would like that. And you could try to aim for maybe 2 to 3 times a week that you go on a walk with her, even if it's just around the block.
I could do that.
If you think that's reasonable, I think that would be another goal that we could add before the next time I see you.
Okay. I believe it's reasonable.
Okay, awesome. Is there any other questions that you had today?
No, I mean, as long as I don't have to eat fish because I don't like fish.
Yeah, no, you definitely don't have to. There's definitely other ways that you can get your protein in with chicken or meat, any other steak, stuff like that. And that's something that we can also start to look at next week, is goals on how to cook it. And I was thinking that maybe your wife can come next week and join in on you, however we are able to meet. So I know she does a lot of the cooking. We can go through and talk about kind of the benefits of the DASH diet and the components, and also some ways that we can reduce fat when cooking, such as cooking chicken and baking it instead of frying it, and tips like that.
Yeah, I think that's a good idea since she does do all the cooking.
Okay, I think that that'd be good. So maybe next time we come, we'll look at your food log for your fruit and vegetable intake as well as sweets. And maybe we can see if, you've achieved your goal about exercising, or maybe some modifications we need to make. And we can talk with your wife too about some good cooking strategies.
Okay.
All right.
Very
Well,
cool.
it was really good to see you and talk to you. I'm glad that we could still meet, and I'm looking forward to our next meeting.
All right. Thank you very much.
All right. Bye. Have a good night.
You too.